Hey everybody, hello everybody. It is 5 o'clock, it is 5 p.m., it is Sunday, it is October, I think 14th maybe. Um, this is Dr. Zarinah. Come on into the room. Hi, Dr. Nina. Thank you for joining us. Welcome to the broadcast. Welcome to the broadcast. Thank you for joining us. Today we're going to be discussing ultrasound. This is for clinicians, physicians, and patients alike. And this information I think is actually understood, not well understood. Hi, Ashley. Welcome to the broadcast. Hey, Dr. Manny. Welcome to the broadcast. Joining us. Please sharing is caring to your colleagues even, because I really do think that sometimes we forget all about this phenomenon, the ultrasound, and how that can be effective and impactful for our patients from an economical perspective as well as from a clinical and better outcome perspective. So, welcome to the broadcast. Come on in. Sharing is caring. I'm going to give it maybe 60 seconds before I jump straight into it, but I think this information you guys will find very useful. It may be a repeat of information that possibly you heard before and that you forgot all about, because even our referral sources, such as our family medicine physicians, I think sometimes we forget that this option is out there for some of our patients, especially, like I said, if it comes down to an economical thing versus clinical outcome. It could be very useful. So thank you for joining us. Hi, Ashley. Hey, I see you. Hi, Dr. Manny. Hi, Dr. Nina. Thank you for joining us. Please maybe invite just one person. Invite one person on into the broadcast so that we can share all this information together. Hey, Robin. Mwah. Hi, Aunt Sandy. Mwah. Thank you for joining us. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Z. In about 45 seconds, we're going to get right into it. I have five advantages for you guys. For you to just kind of make, I'm not going to belabor the point, but it's 5 big points that I think that are possibly, I would say, simple to remember. Again, if you're a clinician or a patient, and just to kind of keep these things in mind as we move forward as it relates to any issues you maybe have from an orthopedic perspective, okay? So sometimes we just forget about it. So anyway, thank you for coming up. Hey, I can see somebody else just joined in, but I can't see your name. So when you get into the room, get into the broadcast, tell everybody, hey, tell me, hey, I'll acknowledge you to make sure that I know that you're here. This is going to be 5 advantages, you guys, of ultrasound over X-ray and MRI. And if I can have some group participation, that'd be great. That'd be awesome. As I go through 1, 2, 3, 4, and 5, I want somebody to kind of just put it down in the comment section, because some people who are going to be seeing this is going to be seeing it on replay. Hey, Ayana, thank you for joining us. Welcome to the broadcast. Welcome to the broadcast. This is Dr. Zarinah, also known as Dr. Z. You guys know me. So I have my maybe 30 more seconds, and then we're going to jump right into it. Hey, what's up? Share, invite one person to the room, invite one person to the broadcast. That's our little thing to make sure that we're sharing this information, right? You never, ever know what people are suffering with. I get that a lot in my instant message or in my direct messaging, that you guys, some of you have actually emailed me to info@drzarinah.com. That's how you can reach me. Hey, Marcus, thank you for joining us. Welcome to the broadcast. Long time no see. Thank you for joining us. Hopefully this information is going to be really useful. We have about 15 more seconds, and I'm going to jump right in. But I am asking everybody to just invite one person. Invite at least one person. You can invite more. I'm not limiting you. But invite at least one person to this information so they can get this information in real time, possibly ask some questions that they are thinking about as I go through them. I'm going to give you 5 advantages and maybe a bonus as well if I have some little time to kind of give you, basically, like I said, some 5 advantages of ultrasound as it relates to orthopedic conditions and even neurological conditions that people, physicians, as well as patients, sometimes we don't think about it. We just don't think about the ultrasound. When we think of pain or muscle or nerves, we don't think of ultrasound. We think of x-rays. When we think of bones, we think of MRIs, but we oftentimes forget about the ultrasound. So let me jump right in. So we are getting started now. Thank you for guys for joining us. This is Rebound Your Health TV with Dr. Z. You guys know me. I am Dr. Zarinah, also known as Dr. Z, your favorite sports medicine, integrative medicine specialist, here to help you rebound your health. That's what I'm here for. Through my concierge medicine practice, through my telemedicine, consulting services, speaking engagements, and authoring, I am here to help you ultimately rebound your health, reaching your pain freedom from the mind as well as the body. You guys know me. I repeatedly say food is medicine, exercise is medicine. Is absolutely, we have the innate ability in our bodies. If we understand it, learn it, and be well with it, is going to optimally give us the best life that we can. And that's what I'm going to be here to teach you guys through my different videos and so on and so forth. Hi, Dr. Jen. Thank you for joining us. Mwah! Thank you for joining us. Welcome to the broadcast. Sharing is caring. Invite one person, and then we're going to get right into this. So this is information again. 5 advantages of the ultrasound as it relates to orthopedic conditions and neurological conditions over X-ray and over MRI. The first one, number one, somebody put this in for me. The first advantage is, I'm going to talk about the non-clinical advantage. The first advantage I would say is it's less expensive. It's less expensive than MRI in general, even if you have insurance, okay? Hear me out, guys. Even if you have insurance, a lot of you know you have insurance, you may have a shoulder issue or a back issue. You have to go through all this red tape to just get the darn MRI approved. I do that as well. I'm a physician. I have to order MRIs as well. But when I can appropriately diagnose and potentially treat a condition in my office, I have the advantage of having an ultrasound machine in my office to be able to point of care, be able to help that patient. So number one, it's less expensive. Even if you have insurance, oftentimes you still have to pay a copay or maybe 20%. While they pay 80%, even that 20% of that MRI that you have to come out of pocket for to cover that MRI, regardless of the body area, is typically going to be more than what you would pay, even if you're a cash pay patient, what you would pay for ultrasound in the office. So that's number one. Number one, somebody write that down for me, is it's less expensive than an MRI at least. Okay, so we're more specific, it's less expensive than an MRI. Okay, so that's the number one advantage. Okay, number two is point of care access. Well, when you think about that, some offices do have X-rays, right? Some offices you go in, they have X-ray machines, and then you get the X-ray, but here's the caveat. If it's not a bony abnormality, such as like a fracture, right? If it's not actually like a bony issue, X-rays don't pick up much. They pick up bony issues, and typically, believe it or not, when it comes to muscle pain or musculoskeletal pain or orthopedic pain, most of the time when they come in the office, it's not because it's a fracture. It's actually going to be related to some other soft tissue phenomenon, such as the muscle, the tendon, or the ligament. And in that case, the X-ray, even if they have an X-ray machine in the office, is not going to be that effective or not a huge advantage, because you're still going to have to do something outside of the office, right, in order to obtain what the diagnosis or what the issue is beyond the examination of course, okay? So point of care, that's number two. Thank you, Ayana. Thank you, everybody, for participating. Wow, awesomeness. Okay, you guys are participating great. So point of care, what I mean by point of care is when I'm in the office, for instance, and a patient comes in and they might have seen, you know, numerous physicians, or maybe I'm the first one that they come to see. I'm able to put that probe with the ultrasound, have my machine right at the bedside, place that onto the point of area of concern, be it whatever the issue or the pain of symptomatology is, and diagnose it right there. As well as diagnose it, but because also it's in the office, I can also then go ahead and treat it. When it comes to the X-ray and MRI, typically you have to send it off for radiology for it, then you have to bring them back, right? Bring it back in the office, assuming that everything got approved through the insurance company, and then bring you back and then try to make a treatment plan, you know, off of that. The advantage of the ultrasound is that point of care, point of access right there. I can actually use that tool as the ultrasound. I kind of use the ultrasound as an extension of the examination. It's not the end all be all. And let me put this caveat in there. I'm not actually knocking MRIs and knocking X-rays. This is just pointing out that it's a underutilized tool in the medical field that I believe is underutilized, that can be very effective, cost effective, as well as advantageous clinically for our patients. So that was number two, point of care access. That meaning that I can diagnose, somebody write that down, and treat on the same day for instance, for certain musculoskeletal conditions or neurological conditions. So that's number two. Yes, that's number two, okay? All right, and then number three that I like, and this is actually probably my favorite, is that it's a dynamic testing, it's a dynamic study. What does that mean, Dr. Z? Essentially what that means is that unlike the X-ray and the MRI, they put you in a little machine or they set you on a table, they tell you to be still and you can't breathe and you can't move and you can't sneeze and all of that. That happens with the MRI and X-ray. But for number three, as I just mentioned, it's a dynamic study. Somebody put that down. Number three is a dynamic study. That's our number three. Hi, Aunt Sheila. Thank you for joining us. Welcome to the broadcast. That also means when the ultrasound, for instance, is a dynamic study because it allows me to move the joint or move the area that's hurting or the symptomatology is occurring. And actually, that's an advantage because I want to. Oftentimes, for example, you might have a rotator cuff. I'll use this as a quick example. And say you have an impingement, or we suspect that this is an impingement syndrome occurring in that rotator cuff. Well, in the MRI, you have to be still. So maybe you don't even, quite move in the, well, actually you can't move, right? They don't want you to move. So hopefully they'll catch that tear or catch that impingement. But the times that the ultrasound is actually very advantageous is because it has a higher resolution and it can detect subtlety. Subtle tears, subtle ligaments, subtle tendon issues, even subtle nerve issues and subtle impingements. That's where that comes into play, because I can't tell you countless of numbers of times, and you guys probably know, as my fellow physicians who are listening to me, thank you for joining us. My fellow physicians who are here in the room with us, as well as some of the patients, you've been where they say, oh my goodness, my MRI was negative, my X-ray was negative. They say nothing's wrong with me. But Dr. Zarinah, Dr. Z, I feel like something's wrong. I know my body, right? I feel like something's wrong. And that's the advantage, and I love having that tool in my toolbox to have an ultrasound available in the office right there when you come and tell me about the problem, to put it right on the area and try to identify the subtleties that were not picked up on X-ray, were not picked up on our MRI. And I can't tell you how much that does for even your mindset, right? To just feel like you had a sense of validation that I knew it. I knew that something was going on. And I actually get a high off of that too, because oftentimes, even if it's not, because again, it's not an end-all be-all, but even if I didn't identify specifically what the ultrasound, I'm here to say that I'm that doc. I believe you. You say it hurts, I believe you. And so our goal together is going to be trying to get to the root of that cause, okay? The root cause of whatever is going on. So that's number 3, okay? And then number 4, I wanted to talk about, when we talked about point of care, less expensive, point of care, dynamic study. Actually, I think that was number 4, kind of wasn't, guys. And then number 5 was high frequency. It has a higher frequency resolution. So that being said, higher than what, Dr. Zarinah? Higher than the MRI. And that, again, it just expounds and goes further into the identifying the fact that, further expounding upon the notion that when it comes to subtleties with certain conditions, such as tendons, ligaments, and even nerves, sometimes we have impingements of the nerve. And I'm actually able to see, or a subluxation. That's a fancy word of just saying that sometimes your pain is caused because the nerve or some anatomical structure is moving, or when you're doing certain motions. But if you're in an MRI or undergoing an X-ray, number 1, the X-ray is not going to pick it up because that's not what it's meant for. It's really meant for bony abnormalities. And number 2, for the MRI, the reason why that's not going to be as highly effective is because you can't move, so you can't put it under stress. You can't create that subluxation sensation for me to pick it up. But on the ultrasound, that's an advantage. Once again, that's something that we actually want to do, okay? So that's a big, big deal. Let me go over that one more time. So we talked about 1, that is less expensive typically than MRIs, even if you have insurance, okay? Number 2 was point of care, meaning that in the office, right there in the office, I can actually diagnose and treat at the point of care when you come in and telling me about it, compared to when you're, if I have to send you out for an MRI, I have to send you, hi, Dr. Creed, thank you for joining us. Mwah. Welcome to the broadcast. Send you out for the MRI. You have to hope that it's going to get approved and then get it scheduled. Sometimes you can be waiting 3 to 4 weeks for it to get scheduled. And that's further delaying, right? That's further delaying the diagnosis, further delaying possibly the treatment plan and the treatment options. And with that point of care, big deal for the ultrasound, of course, is we don't have to wait 3 or 4 weeks. You come into the office, my shoulder hurts, let me put the probe on there, see what I can identify. If I identify something that's one of those subtle issues that is not necessarily a surgical issue, more often than not, I can treat you right there. You walk out of that office and you feel like you had a win. Not the cure-all be-all, although we've done that too. We actually have had some wins like that in the office. Awesome for you guys. But definitely initiate that treatment plan right away. And that's something that I really, really love to be able to provide to my patients, okay? So that was number 3. And then number 4 was the dynamic testing. Hence, that means compared to a static testing, which static testing is like an X-ray and MRI, where they don't want you to move. You can't breathe, can't sneeze, can't chew, can't do nothing. And then with the ultrasound, right, we want you to do that. We want you to move. I'll tell you to move your shoulder to the left, move your shoulder to the right. I'll make those motions for you while I'm watching the screen and identifying the subtleties sometimes of that ultrasound that allows it. And then number 5 was the higher resolution. And for our physicians who understand that as well, and even as a patient, if you're listening to me, the point of that is that the higher resolution under the ultrasound, again, further maximizes the ability to identify those subtleties that sometimes cannot be picked up by MRI. The standard MRI just won't do that. And so under the trained eye, which thankfully I was, and blessed to say that I was trained under the best, some of the best in the world, quite frankly. And that's I humbly say that, but I'm also very fortunate to be able to say that, okay? So, and then we had a bonus, right? I gave you guys a bonus. The bonus was, actually, no, I'm about to give you the bonus. I didn't give you the bonus. So that was number 5, guys. Thank you for participating in that dynamic versus static testing. Absolutely. You got that. Let me make sure I'm not missing any questions. Higher frequency resolution, diagnose and treat the same day for certain conditions. Absolutely. That's awesomeness, and that's a great advantage. All right, so we got all 5 in there. And then because I'm here, you know Dr. Z loves you guys. I wanted to give you a bonus. I actually wrote that down because I was like, make sure if I have enough time, that I wanted to give you guys a bonus. And the bonus is kind of a twofer, right? Again, I wanted to make sure that my physicians and clinicians who are listening to me today also find some benefit in it, as well as my patients. So something that some people don't realize is when it comes to hardware. Some of the patients come into my office and maybe you had some hardware in your back because you had a previous back surgery, or maybe you had a hip replacement, so you have, a rod and things like that. As we know, as at least physicians, that sometimes you can create, you will create artifacts, and it becomes an issue when it comes to MRI imaging, and that could distort the image, which means that's going to distort our information, which means that it's going to distort how we can synthesize that information from the MRI to do anything about it. The nice thing about an ultrasound is that's not an issue. That's kind of taken out of there. You can kind of work around the hardware and there's no issues there, okay? And it's so pretty much anybody, there's no radiation involved in that. In case you didn't know that, I didn't actually use it as a point, but that is a point I want to make. So I gave y'all five, right, advantages. Those are written down into the comment section for those who were participating, and I really appreciate that. Hi, Dr. Shara. Hi, Kesey. Mwah. Thank you for joining us. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Z, and I just went over 5 advantages of the ultrasound over that of the MRI and X-ray that some of our physicians, our fellow physicians, as well as our patients need to really know. Dr. Creedy said that's been educating about hardware. Yes, that's a big, big deal. And I think that, honestly, again, this is a big deal because I actually was having a conversation. That's why I'm doing this particular video about ultrasound, because I was talking to a colleague, and that information, when we start talking about what other things they could do for imaging, just didn't come up. And I was like, what about ultrasound? And granted, most physicians, not all physicians, are trained to do that. At Rebound Sports and Rehab, we are, and again, we have that in our office, be able to provide that for our patients. And that's a big deal, right? To be able to point of care, be able to diagnose, treat that. And it's not very expensive as compared to, even if you have insurance for MRI, to get that done, you're still gonna often pay less. And all the times, the insurances don't mind paying it because they're gonna pay, again, less for the ultrasound, but still get the clinical outcome and the clinical information that we need to make sure that we're treating, doing the best for our patients. So that's really awesome, okay? That was the bonus. So if you missed this, please catch it on replay. We had some great MVPs today here that was participating and writing some of those comments down. You MVPs, you guys rock. I love y'all. You're always there. Hi, Dr. Zakia. I said Dr. Zakia. I'm not calling everybody a doctor today. Hi, Zakia. Thank you for joining us. Can peripheral neuropathy be caused by or aggravated by subluxation? Yes, it absolutely can. That's a great question. Thank you, Cindy, for asking that question. Absolutely, it can. And I've seen that quite a bit. I would say the most common place I see that, believe it or not, is in the ankle area. There's a nerve called the peroneal nerve, or something called the fibular nerve now. When I was in school, it's called the peroneal nerve, but the new school is the fibular nerve. That's a little inside joke for my doctors out there who's listening. But that often kind of can sublux at the ankle and cause people some pain. But it can happen in other areas as well. So yes, that's a great question. And absolutely, that's possible, okay? And yes, to expound upon the topic today, ultrasound can oftentimes pick that up in a way that MRI and X-rays can't. X-rays don't pick it up because it's not meant for that. It's meant for bony abnormalities. MRI can't pick it up because oftentimes that's subtle, and also it's a static study, the MRI. They don't want you to move. But in the office, when you come to see me, and I put that on the area of concern that we think it might be a subluxation, I'm actually going to put that area under stress to kind of identify and see. We can look at the screen together oftentimes, and I can show you exactly how it's subluxing right before our eyes. and to kind of validate what you thought was going on, and also just validate my exam and kind of further, it's like I said, an extension of my examination. So thank you for that question. Do we have any further questions? Do we have any further? Hi, Keisha. Thank you for joining us. Welcome to the broadcast. But again, that was my 5 guys. I gave you a bonus as well about the surgical hardware. MVPs, you guys were out there rocking it and being very participatory in the talk today. So a lot of the comments, guys, look at the comment section too, because our MVPs were there. Type it in case you need to catch the replay. But thank you for joining us. Hi, Michael. Thank you for joining us. Welcome to the broadcast. Please share this caring, guys. This information is useful for people in the healthcare field, or if you're not even in the healthcare field, just to know that that is actually out there. And at Rebound Integrative Medical Group, under the Rebound Sports and Rehab Department, myself specifically, I do have that tool in the office, and I'm very humble and grateful to have it, and very experienced in it as well, and I'm excited to use that with a lot of my patients. I have one more question I think I can take. I just had an ultrasound that I've been putting off for a long time. Oh, great. It made me feel better to know that it's too much. They too such thorough look at it. Yeah, absolutely, absolutely. Thank you for chiming in about that. Exactly. There's somebody who actually has experienced it. So awesomeness. All right, guys, that's it for me today. Again, I am Dr. Zarinah, also known as Dr. Z, your favorite sports medicine, integrative medicine specialist, here to help you rebound your health, ultimately through my concierge practice, my telemedicine practice, speaking engagement, authoring, and consulting services. I am here to help you reach your pain freedom. You guys can actually reach me at info.drzarinah.com to schedule your very own, no obligation, 15-minute consultative service to identify, kind of like a discovery session to find out if some of this would be appropriate for you. We'll be here for you. So just don't worry about it. Go ahead and email us at info@drzarinah.com. And don't forget to follow us and like us on Facebook at facebook.com/Dr. Zarinah. That's DRZARINAH. Thanks for joining me. Mwah. We'll see you guys next week. This is Rebound Your Health TV with Dr. Z. And you MVPs, go out there and rock it. All right? Rebound your health, guys. Love you. Mwah.